Right, and our top focus of this bulletin is COVID cases. In fact, as we see today, the COVID cases have seen a spike in metro cities in the last 24 hours. In Mumbai, COVID cases hit a 42-day high with 871 cases logged in a day, while in Delhi, again, the trend of logging over 2,000 cases in a day continues, with 2,136 new cases and 10 deaths being reported over the last 24 hours. Among the 871 cases in Mumbai, 95% were asymptomatic. This is the highest single-day case count after July 1st, when 978 cases were reported in a day. The COVID positivity rate in Mumbai is at 10%, while in Delhi it's at 15%. In order to discuss this further, I'm joined by Dr. Sanjeev Bagai, CMD, Nephron Clinic, and Dr. Ishwar Gilada, Secretary General of OMAG. I'm going to go first to Dr. Bagai. Dr. Bagai, looking at the situation in Delhi, if we look at that first and then at Mumbai, Delhi has been seeing consistently 2,000 cases and above on a daily basis. There have been schools which have now started thinking, or some of them already adopting, a hybrid mode of education, having some online lectures for certain students and offline physical mode of classrooms for other students. Now, is that, those are some of the measures that we're seeing in Delhi. The government has also gone back to the mask measure, the mask mandate. So is Delhi, a situation where now other metro cities need to take cue from and actually look at bringing back some of these measures? Not very stringent, but some measures which need to be brought back? Or is the situation in Delhi is a separate issue altogether because it's seeing high COVID positivity rates. So, the other metro cities can strategize on their own. What would you have to say on that?
Good afternoon. I think we've seen Omicron in various parts of the country at various intensities, and it hasn't actually gone away. So really the carry-home messages and bullet points are that Omicron is still here. It has newer sub-lineages, and I want to dwell into that just for 30 seconds. The initial origin, ancestral Omicron of BA.1 and BA.2, and what we are seeing now as BA.2.75 and BA.5 are totally distinct. They're antigenically distinct. The amino acid mutations are distinct. We are seeing a higher percentage of vaccine escape infections and breakthrough infections, both separately. And the real reason is that the antigenic sites where the antibodies would act have actually been closed down, and the receptor binding protein where it attaches is actually now in what we call as a conformation of 3 up. Apart from that, Omicron enters not only from the ACE receptors but endocytes. So it's a backdoor entry. It hitchhikes and hijacks the immune system. Having said that, I think Delhi masking is important. I think we need a revised public awareness message campaign. The message should be as follows, that there is no need to panic. There is no crisis. We are not looking at a catastrophic situation like the second wave. Our vaccines have held extremely well. We are reaching 210 crores, which is a monumental task. I would urge everyone to get the third shot, which is the booster shot. And the reason for this is that 2 shots and 4 months later, your immunity wanes. That's the nature of the disease and the way the vaccines work. Your antibody levels go down. Your third dose will enhance your antibody levels, make it more potent. The breadth and potency of it and the trajectory changes. It's primarily because from the germinal center. But I think we need to mask, especially in close, crowded places. You need not wear it at home, but be careful. You may be asymptomatic, a large percentage. And my concern is a lot of patients in Delhi, at least, have got COVID-like symptoms. There's an online consultation, and a lot of them get the home test, what we call as a rapid antigen test. Largely, these tests go unmonitored, and then they don't follow it up with the RT-PCR. It's a home isolation for a few days. And this few days is an extremely slippery and catchy word. Although CDC and WHO have mentioned 5 days, that is insufficient. It should be minimum 7 to 9 days of isolation. Mask up, keep safe, get your third dose done. Children are now being vaccinated. It's an important segment, especially in India, where at least 40 to 45% of the Indian population are the pediatric age group, and the pregnant ladies also need to be covered. So I think we need a comprehensive strategy going forward. Again, the bottom line is there is no need to panic. We are safe, but we need to keep precautions, keep well. Health is in your own hands. It's not a state subject. It's not a national subject. It's an individual subject.
Right. Right. What we can, in fact, see is that it is an individual subject and probably the strategy needs to be improvised upon basis what the state government is going through at this point in time. Bringing in Dr. Ishwar Gilada. Dr. Gilada, if we can, in fact, look at what Dr. Bagai was also saying, that there needs to be an approach which has to be improvised from time to time basis the situation at hand. But what we have in fact seen is that Mumbai has been consistently a cause of COVID concern. Although we have not seen the city administration, the civic authorities or the state government for that matter bringing back any such measures which we are seeing, for example, in Delhi. And the numbers are also not that high for now. But there is a spike. There's a 42-day high that we are seeing at the moment. It's nearing 1,000 per day mark. So does Mumbai also, and especially knowing the density and the other, concerns specific to Mumbai, is it time for the civic authorities and the state government to take measures in advance in order to curb the spike, which we can see right now?
Yeah, Tanima, basically, we should not look at only numbers, because what is happening today is if we see numbers, we get panic. We would like to have some kind of knee-jerkism. You look at the trajectory. What is happening after people getting infected? How many of them are requiring oxygen? How many of them are requiring bed or ICU or ventilator? And what is the death rate? What we have seen consistently for last 2.5 months, 3 months is a case fatality rate is only 0.1%. And currently it has reached to 0.2 to 0.3%. And this is probably because a lot of people are testing at home. As Dr. Bagai said, people are not informing others. Therefore, when they are sick, they will land up in hospital. But if they are found positive, they are not informing anybody. So therefore, the case fatality rate may be around 0.1% only. But because it is getting concentrated, less people are getting tested. Secondly, we should also compare what is happening in the rest of the world. In Japan, Japan is reporting 15 lakh cases. Japan is so small country as compared to India's population. 15 lakh cases per week. That is at least 2.5 lakh per day. And that is currently highest in the world. You look at West, where they have a B4 and B5, which are having a lot of infection rate. Currently in India, it is BA2.75, not much of BA.5 or BA.4. So infection rate is not that much. And secondly, everything is opened up. Now it's already COVID fatigue. If you ask people to use masks, they are not going to use. So we should ask where to use masks. As Dr. Bagai said, in closed doors, in public places, public transports, if you are traveling, you should use masks. Otherwise, no special mandates are required till the trajectory changes. And I don't think trajectory is going to change. I don't think COVID will settle down. COVID will continue to be with us. Currently, there is a problem with common flu, COVID, H1N1. So a lot of people are getting confused. In Mumbai, we are seeing a lot of H1N1 cases now, which was not seen in earlier time or even last year. So because of that, there will be some confusing picture. But I think there is no cause of concern. We should continue to vaccinate, as Dr. Bagai said. We fought a lot to get the vaccine for the 60 below population free of charge. Government of India has decided to now provide that. We also fought a lot to get the duration between the second and third dose reduced from 9 months to 6 months. That is done. So I think from administration side, from government side, from medical community side, everything is done. Ball is in the people's court. Take the vaccine, it will definitely protect you. And probably that is the reason that we are well protected as compared to many other nations.
That's
and
right.
Lastly, our vaccine is better than mRNA vaccine. Covishield is providing more than 6 to 8 months protection, whereas mRNA all over the world is providing only 4 month protection per dose. So they are going into 4th dose, 5th dose, and we are just into 3rd dose now.
Right. They're very important words there, both from Dr. Sanjeev Bagai and Dr. Ishwar Gilada. Thank you so much to both of you for joining us on this short but very important discussion that we had about COVID spike in metro cities, especially in Mumbai and Delhi.